Welcome to another Anatomy and Physiology 2 Bio 265 video in a nutshell. Today we're going to be talking about the cardiac cycle graph, and while it might look confusing, like a bunch of crisscrossing lines that don't make sense, you'll be surprised at how easy it is to actually understand, because the entire graph is built on 4 points. Serious, just 4. So let's take a look at what's actually happening inside of the heart, so that all of these confusing lines can start making sense. So the heart's made out of muscle that can contract and then relax. Up at the top we have the 2 atria, and they can contract to push the blood that's inside of them through a one-way door or valve into the bottom chambers of the heart called the ventricles. And the ventricles then squeeze, and they push blood out to the lungs or to the body respectively. And I know that in real life all the valves, arteries, veins, everything's at the top of the heart. But this video isn't about anatomy, it's designed to explain heart function. So this process is going on simultaneously on both sides of the heart, but we're just going to focus on the left side of the heart. Specifically, let's look at these one-way valves. These valves are controlled by pressure. So higher pressure in the atria is going to push the mitral or bicuspid valve open, allowing blood to flow through. Whereas on the flip side, if the pressure is higher in the ventricle, then it's going to push the door shut, stopping blood flow. The blood can get through there when the one-way door is closed. So the aortic valve, it functions on the exact same principles of pressure in order to open and to close. So pause the video if you need to and think about it for a minute. Where do I need higher pressure if I want to open the aortic valve? Do I need higher pressure in the ventricle or in the aorta? And where do I need the higher pressure if I want to close the aortic valve? In the ventricle or in the aorta? So the answer to those questions, if I want to open it, I need higher pressure in the ventricle to push the door open. And if I want to close it, I need higher pressure in the aorta to shut it. So this pressure is caused by the heart muscle contracting. And so when they contract, they squeeze the space, making it smaller. Boyle's law, the idea that pressure and volume are inversely related. So in simple terms, when I squish all the blood in the ventricles into a tiny space, it's all crammed in there, it builds a high pressure, and it wants to get out. So let's throw out some theoretical numbers. Let's say the atrial pressure is 5, and the aortic pressure is at 80. Let's say that the ventricular pressure is 10. So, in this case, the mitral valve, open or shut? It's going to be shut because 10 is greater than 5. What about the aortic valve? It's also going to be shut. 10 is not greater than 80, so we don't have enough pressure to push this aortic valve open. We have to pass 80. Now, remember, the atria on the top contract first, and then the ventricles on the bottom. So let's take all this information and actually put it onto the graph. So the entire graph, remember this, focuses on what's happening in the ventricle. So these terms, systole, diastole, they refer to the ventricle. Systole means to contract, or to squeeze, and diastole means to relax. So systole means that between these solid black lines here, the ventricle is squeezing. And between these solid black lines, the ventricle is relaxing. So think about it for a sec. During systole, if the heart muscle is contracting, what will the pressure do inside the ventricle? So it's going to increase. And that high pressure, which valve is it going to affect as it goes on up? It's going to affect the mitral valve. The instant it passes 5, the mitral valve is going to be closed. So let's take a look at the cardiac cycle graph. We see, as soon as the black line of systole begins, we have a sudden peak in the blue line representing ventricular pressure. And notice that the point where ventricular blue passes atrial black is right at the beginning of systole, the instant the ventricle squeezes. 5's an easy number to beat, so the door shuts almost instantly. That is point number 1, the closing of the mitral valve. So think about the valves at this point. Mitral valve's closed, because we're higher than 5, but we have to get higher than 80 in order to open the aortic valve. So, which valves are open? Kind of a trick question because none of them are open. We're increasing between 5 and 80, but the blood has nowhere to go even though the pressure is rising. Therefore, this phase is called isovolumic, same volume. Between 5 and 80, it has nowhere to go. So this isovolumic contraction sits right between the solid black line and the dotted line. We're waiting for this ventricular volume to rise high enough to beat the aortic. And notice that the ventricular volume line is a flat line. It doesn't change. It can't change in the isovolumic phase. Now, once the pressure inside the ventricle passes 80, what's going to happen? Well, I'm going to be able to push open the aortic valve. And so take a look here. We have the ventricular pressure increasing. We have our aortic chilling at 80. And the point where they cross is right on the dotted line representing the end of isovolumic contraction and the beginning of ejection. This is point number 2, the opening of the aortic valve. So what would you expect the ventricular volume to do during this ejection phase? We're pushing our blood out into the aorta. Well, it's going to be pretty straightforward because it's going to decrease. All the blood's leaving. And take a look. Sure enough, we see that decrease in the ventricular volume line. So as long as the ventricle is in systole, as long as it's squeezing, these pressures are going to be fighting back and forth, but the valve's going to stay open. However, as soon as systole ends, notice that the black aortic line beats the ventricular line. The ventricular is just plummeting. And at that point right there is where the aortic valve is going to close again. Aortic's higher than ventricular. So we can see that as this drops, this door is shut. But at this point, which doors are open? Another trick question, like last time, because none of them are open. No valves, we're isovolumic. Until we get below 5, we are in another isovolumic phase, and note, we have another flat line. No change in the volume. It has nowhere to go. We're less than 80, but not yet less than 5. So, in order to reopen the mitral valve, the ventricular pressure needs to be less than what? You know the answer. It needs to be less than 5. As soon as it's less than 5, the mitral valve can reopen, and blood can flow back into the ventricle. It's just a matter of time for the muscle to relax. So that point right there, right at the end of the isovolumic relaxation dotted line, where the blue line drops below the black atrial line again, is point number 4. And at that point then, as blood rushes into the ventricle, we have our rapid inflow phase, and you can see the sudden increase in ventricular volume that happens. So, I want you to do a quick mental review. Walk through each of these 4 points, and I want you to think about which valve is opening or closing and why. What's causing it to open and close, the pressures, where they're at. So point number 1, mitral valve closes. Why? Point number 2, aortic valve opens. Why is it opening? 3, aortic valve closes. Why is it closing? And 4, mitral valve is going to reopen. Why is it reopening? Jumping back over to diastole, we have this phase of rapid inflow, and we have this sudden increase in ventricular volume. And then right after that, it kind of levels off in this phase we call diastasis. Notice that diastasis and diastole have the same root. They both mean to rest or relax. So it's literally a rest within a rest, and not much is happening. After that, we have atrial systole, atrial contraction. And the atria are going to squeeze. Remember, they squeeze first and then the ventricles, like we talked about. And they squeeze first to top off the blood in the ventricles, to push the last little bit in. So you can see this little increase in ventricular volume. So then, of course, we're going to have another systole, and everything is, the pressure is going to rise, and the mitral valve is going to shut, and the whole thing's going to happen all over again. But let's take a minute to talk about the heart sounds and the electrocardiogram. We'll get to that, but the heart sounds first. So they're easy when you realize that heart sounds are caused by valves closing. So which of these four are caused by valves closing? Think about it. 1 and 3. Well, guess what? Heart sounds happen after 1 and after 3. And let's talk for a minute about the EKG. Now, I realize that there's a section in the textbook talking about dipoles and electrical movement. This video is in a nutshell, so it's designed to be simple. So these are the EKG basics. Think about the EKG like electrical instructions telling the heart what to do. P wave tells the atria to contract. QRS tells the ventricles to contract. T wave tells the ventricles to relax. Now you might have noticed that there isn't a signal here for atrial relaxation. That signal does occur, however, it happens at the same time as the QRS complex, and the QRS complex is so big that it completely buries the atrial signal, so it doesn't show up on the graph. But think about these signals kind of like a starting gun at a race. So the gun goes off, and then just half a second later the runners will hear the gun and off they go off their marks. But the gun comes first. So in that exact same way, the electrical signal telling the heart what to do has to come before the heart can actually contract. So take a look, we see that. Here's our QRS, happens right before the solid black line of systole that it causes. Again, T wave happens right before the diastole solid black line that it's causing. And the P wave happens right before the atrial systole dotted line that it is causing. So, there you have it, the entire cardiac cycle based off of 4 points. If you can remember the valves opening and closing, and then understand which pressures are causing them to open and close and connect that with the heart actually squeezing and relaxing, you can recreate this graph from memory any day. Thank you, and good luck with your studying.